Our last speaker is Dr. Daniel Nielson. Dan is an associate professor of political science and director of the Political Economy and Development Lab at BYU, Brigham Young University. He's also a co-founder of AidData. He's been there since the beginning and now a principal investigator with AidData and a consultant for CCAPS. Dan received his PhD in international affairs from UC San Diego, and he's sort of a jack of all trades, but his latest research employs randomized controlled trials to better understand the relationship between aid, transparency, control of corruption, and development outcomes. So, thanks for coming, Dan.
It's good to be here.
Send it over to you.
Okay. It's an honor to be here, a pleasure, and especially with such a distinguished and interesting panel. I'm going to start this presentation the way we so often start in development aid, with Oliver Cromwell. After he ended 1,000 years of English monarchy by beheading the monarch, he sent a letter to the Scottish Synod and said, "I beseech you, in the bowels of Christ," you could insert anything about calling on the mercy of heaven, "think it possible that you might be mistaken." As policymakers, as NGOs, as interested parties in development, we have a lot of preconceived ideas. And they're probably wrong. But we'll never learn if they're wrong unless we update. And for that, we need information from the source of those who have it. And Cromwell, to his great credit, despite other things, took an important step forward by crowdsourcing governance in a very large way, by devolving a lot of power to the English Parliament, and the product of that in lots of ways is what we have today with modern democracy. Modern democracy, in my view, is just crowdsourced governance. The government trades influence over policy for tax dollars. The problem with foreign aid is that the resource flows in the other direction. And so how do we get information that will let us update, let us learn that we indeed are mistaken, and then move forward with that information and improve the lives of those we're supposed to be serving? So USHAHIDI, as John touched on, has done some amazing things. One of the things I love about USHAHIDI, and one of the many things, is that this incredible tool has come to be very important for the developed world, came from the developing world, which I think few people wrongly didn't expect, and really has reshaped the world in important ways. The next step, in my view, is figuring out how to motivate people to do citizen monitoring when there's not a crisis. And for me, that is very important. And that's what we're doing with UReport in Uganda. This is a system that UNICEF developed to get citizen feedback from citizens using SMS text messaging, and then it brings it together in a centralized system. And they've been consulting with USHAHIDI and how to do that better, and no one knows it better than USHAHIDI. They currently have just over 30,000 UReporters spread throughout the country of Uganda that answer weekly polls, give information on what's going on in their neighborhoods and villages. For example, what is the most egregious form of child labor that you routinely observe in your village? Or what is the age of marriage for most girls? There's a variety of things that they do, and those UReporters report. Mostly right now it's an information gathering tool, but we hope that it will become even more than that. So first question is, how do you recruit these people? How do you get them to sign up and text join on their cell phones to be part of this UReport? Once they sign up, how do you motivate them to actually report, to give you the information that will help in improving your projects? And finally, what are the effects of this reporting on other outcomes that we have reason to value, especially substantive outcomes of development? What I'm going to tell you about here today, the project that we did, really just dealt with the first two. The next project that UNICEF has planned in Uganda, along with the World Health Organization and DFID from the United Kingdom, does the next step. And they're hoping to use U-Report to do that, and we'd love to be involved if we can. So we're going to answer those first two questions. We tried to answer the first two questions using a tool that many of you are familiar with called the randomized control trial. Just like drugs in learning whether or not a new pharmaceutical will actually treat a disease, you need to randomly assign half of your subject pool to the drug and half to some placebo, and then you have an outcome measure. Did they get better or not? And the difference between placebo and control tells you just how effective that drug is. The powerful thing about that is that the random assignment, as my colleague Mike Finley said earlier today, creates a lot of power, right? In expectation, what this means is that all of the factors that might affect whether or not the drug is successful or not are balanced by the randomization, at least in expectation, right? There are ways that can go wrong, and some of them actually happen in this project. So we tried to correct for it. Not only does it balance all of the factors that you can observe, it balances all of the things you can't observe. This is how modern medicine has become a science, as opposed to leeching and bloodletting, and because it's a really complicated process. The great light went on for me when I realized you could do this not just with medicine, but with anything that you want to evaluate effects, and you can do it with groups of people, not just individuals. That was the light for me. So, what motivates the crowd? The psychologists and economists have been having a big fight, and the economists believe that people are motivated by money, not that alone. There's lots of things that motivate them, but material rewards matter. Psychologists, on the other hand, believe people are mostly motivated by the act itself, especially when it comes to things that they have reason to value based on principles and ethics. And in fact, if you've got a profession that is highly intrinsically motivated because it's pleasant, if you put any sort of bonus pay or things like that on it, it's going to make people perform worse because now they care about the money, right, instead of the inherent value of the activity itself. So the action is its own reward. There's some social benefit or some feeling that you're doing something good for the world, or is it are the psychologists right or the economists right? Is there some additional material reward? We thought there were a few possibilities here. Maybe both intrinsic and extrinsic incentives work together to motivate people. But it's possible, and lots of psychological research and behavioral economics research suggests that actually giving people extrinsic incentives for intrinsically rewarding things actually dampens the power of that intrinsic motivation. So we wanted to test this in this setting with U-Report. We decided to divide Uganda geographically by district, 116 districts. We signed most of the districts to a control group, in part because, as I'm going to show you in a minute, some of the treatments didn't respect the district boundaries very well. So there's the control set. The first question, of course, is how do you recruit these folks? And the first thing we tried was radio advertising. Sign up for U-Report, make a difference in your community was the basic story of the radio ad. By the time that we did these interventions, they already had more than 10,000 U-Reporters signed up based on a television ad that was sort of recast as the radio ad. So we knew it worked in part from the prior experience. So we ran these ads for 5 days in these 6 districts. And then we had a period of hiatus. The idea is here, motivate them with intrinsic rewards. And then we ran the same ad again in another 6 districts. Instead, it was the same ad, and then we added at the end. And if you sign up as a U-Reporter, we will enter you into a lottery to win a Google Solar Charger. So, small probability, only 1 per district, but maybe that extra material reward would make a difference in whether or not they signed up, was our question. So those are the 2 treatments we had for recruitment. Which one would work better for recruitment? Next, the question we asked was, what motivates them to actually send in those SMS messages to give us information about their conditions on the ground? The first intervention we tried was human feedback. So I had a team of undergraduate students with me in Uganda for the summer, and the team of researchers actually sent back text using the U-Report system to all of the people who sent in this treatment group. Giving them human feedback, hopefully that would, the connection with someone else, knowing that someone's on the other end listening, would make a difference and make them more inclined to report. We also did a lottery. We told them that if you answer all of our polls, we'll enter you into a lottery to win a Google Solar Charger. So here we were able to separate much more cleanly the intrinsic from the extrinsic. And finally, with apologies to Twitter, we organized them into groups so they could talk to each other about themes that matter to them. So there was an education group, a health group, a child and youth group, right? So there was a set of groups that they could affiliate with. We told them about them, and during those few months of July and August, they had interactions. So here are all the treatments on the board. Some of the treatments actually never got put in play. We were relying on partners that were less interested in this than we were, and here are the results. In part because the radio waves, very stubbornly did not stop at the district boundaries and continued to broadcast throughout the country, we had to both use the geographic isolation and the temporal isolation of the periods to see the effects of the treatment. So I'm showing you this 1 month of the number of new U reporters per day in Uganda. And there's kind of a baseline. You see that from the 20th of July, through about the 1st of August when we started the radio treatment. And you see a big bump there. That's statistically significant. Many more U reporters signed up when we had the radio treatments in the field than just through the basic operations of word of mouth and the work of the UNICEF partners that were trying to recruit U reporters. And the radio lottery, I don't know if I put too much stock in the reduction from the radio lottery. We just didn't know. No one knows how far those signals went and how many people they reached. Right. So it was significant. It was better than the baseline. We don't know exactly how many people it reached. You can see that on the 12th of August they did a national campaign for about a week, national radio ads, and you can see that the number of U reporters per day increases dramatically at that point. It looks like the radio treatment might have hit about a third of the country. We were just trying to hit 6 districts, but those pesky radio waves just wouldn't cooperate. So here's the results for response rate. Did they respond ever to any one of the polls that were sent out weekly? And there's the answer. I was going to ask you, how many of you hold with the economists? How many of you hold with the psychology? You have to be honest with yourself now and say which one was more compelling to you. But these data suggest that the economists win. That there is an additive benefit to providing a small material incentive to people to have them sign up, and a standalone benefit to having them have that small material incentive to do something they may have been inclined to do otherwise. And the response lottery was the most effective at getting people to actually send in texts. The radio lottery following close behind. The other analysis we did was how many texts did they send? How many polls did they respond to over time? And of course, they can respond multiple times, giving you more information, as some did. Some in the control group actually responded 140 times. Right, the texts were free. We reimbursed them for them, and some of them were a little chatty, and so. They were all in the control group. None of those were in the treatment group. The ones that responded quite a bit like that. So here again, response lottery has the biggest effect. And again, radio lottery second. The ordinal is still the same, but you can see the cardinal values are a little different. We got about 30,000 messages during the treatment period. What did we learn? How are we correcting our errors, right? Our biases. it turns out the crowd is pretty motivated already. Even with the baseline control set, almost half of the U-reporters were responding at least once. And a large share were responding more than that. It looks like there's an added benefit, right? People might be inclined to do it otherwise, on its own, but if you give them just a little material incentive, they're even more inclined. And we thought that there might be some dampening effect, but that doesn't seem to be, at least in this setting. Now, what we haven't done yet, and what we hope to do, is compare the quality of those texts, and that is interesting. I've read several hundred myself, and it's little Twitter snapshots of the lives of our U-reporters, and remarkable insights that come from them. I think similar to what Brit has experienced. And this is to me, one of the greatest tragedies in development is just how much waste there is of human ingenuity and ideas, right, and common sense that we just don't make enough use of. Okay, there's a lot left to learn, right? I mean, these data are preliminary. We just run them recently. There's a lot more to do. There's some cleaning to do, and more to learn. The next step for U-Report, at least that UNICEF has planned, is, does this have an effect on actual outcomes in development that we care about? And what they're interested in seeing is, does U-reporting reduce the shortages in malaria drugs that are pretty common in Uganda, as the drugs are stolen and sold on the black market, and they want to see, can you use these U-reporters to actually check on the clinics, find out if the drugs are there, relay that back, and then get the information to the appropriate parties. And this is with WHO and DFID. And I'm very curious to learn. I hope we can build in an RCT component into that to learn what works better. DFID really likes the hotline idea, right? An anonymous hotline. UNICEF is all, of course, committed to U-Report. We'll see how they duke it out. We might add another intervention if we're successful about public meetings to see what happens with that. So lots of different ways to crowdsource. We're going to try to see multiple interventions, see what happens. Okay. Next step for us is for all of us here is to keep thinking we might be mistaken. I just realized that I'd modified the slides in the PowerPoint version, but not here on my Mac. So I want to talk for a minute about what we're going to do in AidData. So we have a plan to do what we call the enhanced project view. So I want you to just imagine, right, seeing it, right. On the left-hand side of the screen, you see the standard AidData information on the project that's provided officially by the donors themselves. On the right-hand side, you see a crowdsourced set of information, and that is provided both by users, by donors, by NGOs, by anyone that's interested in that. And we envision kind of a permeable membrane between the two, that some of the information that's provided by the crowd will be especially important and will actually make its way onto the official side of the project view. But on that crowdsourced side, you can imagine donor documents they make available. You can imagine television interviews, right? Newspaper reports. You can imagine comments. Right, and Brad Parks has actually put this together, and I'm sorry, Brad, I muffed the handoff here, that shows for real projects just what kinds of rich information you can provide that can give information to the beneficiaries, and that can spark a really interesting and probably productive dialogue among all of the stakeholders. So that's what we're hoping to do in the future with some of this information that we're gathering through these kinds of methods.